welcome back to my channel. I'm really so thankful that you guys have been watching these videos and you've been commenting and many of you have subscribed within the last couple of weeks. I really appreciate it. I know I could not do it without you guys, so I really appreciate the many of you who have subscribed within the last couple of weeks. Thank you so much. And today we are going to be talking about a topic that you don't hear much about. We know it's there, but a lot of people don't talk about it. And we're going to be talking about hair loss, something that we call alopecia, hair loss. Many women are going around with hair loss that they are really concerned about, but you wouldn't know because they are wearing wigs and they're covering their heads, but some women really grieve the loss of their hair, especially those who are going through chemotherapy. Two things that women who are going through cancer treatment and losing their hair grieve the most is the loss of their hair and the loss of the body part. Of course, for breast cancer individuals, losing a breast can be very traumatic to a lot of women. So there are many reasons why women lost their hair, right? Why they lose their hair. And it could be just because of some protein deficiency. Now, definitely your diet has to be up to par. If you want healthy hair, you have to be eating the right things, to allow your hair to grow healthily. Definitely, if you have thyroid disease, a lot of individuals, not just women, but men, have thyroid disease and they're actually not even aware of it. So you'll find there are a lot of individuals who are going around with, weight gain, and it has nothing to do with food. It's just that the thyroid gland is not functioning properly. And so when your thyroid gland is not functioning properly, you can also have hair loss. And so if you are stressed out, definitely if you are stressed out, you're going to be losing hairs and you're wondering what's going on, but it's because you are so stressed out. If you don't get enough sleep, of course, if you don't get enough sleep, it means that it's interfering. If you don't get enough sleep, it is stressing you out. Definitely, if you don't get enough sleep, you're going to be stressed out. And that can cause your hair to drop. Okay? Now, today we're going to be talking more about the ladies who are going, or the guys who are going through chemotherapy and losing hair. Sometimes hair loss occurs within, sometimes the first chemotherapy dose that you get, you're going to see hair loss. Sometimes it's going to take a little while longer. But it can be just gradual, or it can be just very dramatic. Like some women will wake up and they'll just have clumps of hair falling onto the pillow, or when they're taking a shower, the hair will just fall off into the bathtub. So it may be gradual, or it may be just really dramatic. Now, some of the agents will cause just partial hair loss. And some will cause, or some of it will cause hair loss in particular areas, and some will cause complete hair loss. Yeah. So the extent of hair loss that you have really depends on what drugs you are taking. So if you are going through breast cancer and you are taking adriamycin, definitely this is gonna cause complete hair loss. You're gonna lose everything. That is hair, eyebrow, eyelashes, axillary hair, pubic hair, everything is going to fall off. You're gonna be bald, like I was when I was going through cancer treatment. Okay? And some drugs will just call, if you're taking like Cytoxin, you may have just minimal hair loss. And if you are taking Taxol, which is another drug that you take for breast cancer, this is gonna cause complete hair loss. If you were taking radiation therapy, radiation treatments, especially if you're taking radiation treatments to your head, of course, some of the cancers metastasize, meaning they spread to the brain. And sometimes you may have complete, radiation of your head. And so if you are taking that, you're going to lose some hair, and some of it may be just permanent bald spots, and some of it is hair loss that's going to grow back. And with the ladies going through breast cancer treatment who go on a tamoxifen, the hormonal therapy, it may cause your hair to thin out. But you know, you take that tamoxifen for 5 years. So within the first 1 year, you may have, you know, accelerated hair thinning, but that's going to level off. Although in some cases, your hair thinning may last the entire 5 years that you are taking tamoxifen. So definitely, depending on what drug you are taking, will depend what amount of hair loss you have, and if you're ever gonna get that hair back. Okay, most of the time your hair loss is going to come back. But like I said, if you're going through radiation therapy where you're having real bald spots that may be permanent and may never come back. Yeah. Also, depending on how often you are getting treated for your chemotherapy. So if you're taking chemotherapy weekly and the dose is small, you will have so if it's a low dose, it's taken weekly, you will have less hair loss. But if you're taking it monthly and it's a large dose, then you're going to have more hair loss. So it really depends on what drug you are taking and how often you are taking it. Now, when will your hair grow back? Okay, some people are, once they've started chemotherapy, they're wondering, when is my hair going to go back? Okay, so once you've completed chemotherapy, right? After you've completed chemotherapy, 2 to 3 weeks, you will have the little soft, fuzzy, little thin little hair growth. It almost looks like little baby's hair growth. By 1 month, your real hair starts growing, and 2 months, you're gonna have at least an inch of hair growth. Your regular hair is gonna be growing back, right? So your full head of hair will vary. It varies from person to person. It depends whether you're gonna have your full, beautiful head of hair back, or if you're going to have ongoing, you know, thin and fuzzy little, you know, texture. So it all depends on the individual. It all depends, of course, on the drug that you had. So when your hair comes back, your hair will either be curly, which a lot of women love. When you start growing this 1 or 2 inches of hair, you have this beautiful curly baby looking hair, and a lot of the women actually love it. You actually wish it would stay like that forever, but no, it actually comes back to your normal hair. So let's talk about how you should cope with hair loss. And that's not just for ladies going through chemotherapy. It's actually for anyone who's experiencing hair loss, unexplained hair loss, and has to find a way to cope with it. Okay? With every problem that we develop, we have to come up with coping mechanisms. How are you going to cope with your hair loss? And you know, some ladies, for those who are going through chemotherapy, you know, some women have this beautiful, lovely head of hair, and all of a sudden it disappears, it vanishes. And that's a fact of life. There is really nothing much you can do about it. I believe, and I tell, you know, my fellow breast cancer survivors, that when you are diagnosed with cancer, it is really a battle for survival, and you really do anything to survive. And if that means hair loss because you're going to go through chemotherapy, you do it. And if that means losing your breast, then you do it, because you'd rather be alive than having a full head of hair. Or you'd rather be alive with 1 breast rather than dead with 2 breasts, right? You agree? Okay, so how do you cope with your hair loss? First, you have children. If you have children in the house and you know, they're used to mommy having a full head of hair. Of course, most kids like to play with their mommy's hair. And you know that you are going to begin chemotherapy and all of a sudden the beautiful head of hair that mommy had is going to go away. So how do you prepare that? How do you prepare yourself? How do you prepare your children? How do you prepare your spouse, if you have one? Now, it is recommended that if you are planning to undergo chemotherapy, that you go ahead, and if you're going to have a long regimen, 6 months with the Taxol and the Adriamycin and everything, you know definitely you're going to have complete hair loss. So you go ahead and you cut that hair off before you start treatment. If you cannot deal with the big clump of hair falling off into your hands or falling off into the bathtub, so then before you start chemotherapy, you want to go ahead and cut that hair off. You want to cut it short, or you want to cut it or shave it off altogether. It's just so much better to deal with. To make that transition from a full head of hair to a bald head, it is so much easier if you start that process yourself, meaning you cut that hair off. Yeah? With the children, you want to tell the children, you want to be really transparent with them and tell them, mommy is going to get treatment, and one of the problems with that treatment is that my hair is going to fall off. Yeah? But you tell them, mommy is still going to be pretty because I'm going to be wearing beautiful hats and beautiful caps. So you prepare them psychologically. So when your hair begins dropping, they wouldn't be questioning you. What happened to your hair, mom? What happened? So you prepare your children. You also prepare your spouse. You know, it's part of the education. You receive the education from your healthcare provider. You come home and you educate your family. You tell them what is expected. What's going to happen during the treatment phase? You're going to lose hair. You're going to have other symptoms, you know. Some women going through treatment are going to have black tongue and the palms are going to be black. So if you are properly educated by your healthcare provider, then you turn around and you educate your family so you all can go through that journey together. So you tell them, mommy's going to lose hair during treatment. Yeah? So they will be prepared. Some of the things you also want to do is reassure them that your hair is going to come back. You may even want to tell them, I'm going to have this pretty short hair at the end. You want to tell them that it's going to come back, so they can actually go through that journey with you when the hair starts growing back. You want to help them, let them help you pick a wig. Take them to the wig shop with you and let them help you. Because what's pretty to you may not be pretty to them, right? And I know it's all about you at that time, but you also, you know, want the kids and your spouse to be happy, so you let them come help mommy pick a wig, yeah? Also, if it's an issue with the children, what you want to do is keep your hair covered, so they won't have to be looking at the bald head all the time if it's, you know, it's not, you know, pleasant to their eyes. So you want to just go ahead and just keep your hair covered. And we will talk about the different ways you can still look beautiful with or without hair. Yeah? Okay? And you also want to talk to your husband or your spouse or your boyfriend or whatever, your fiance. You want to talk to them, and it's always very important that you guys talk about, you know, what's going to happen, especially when a woman is losing her breast. Yeah? You know, having breasts is sexy, of course, not just for you, but for your partner. And so losing it can sometimes be very problematic for some people. They have a hard time dealing with it. So you guys want to talk about that and allow your spouse to make the decisions. Some women need to have bilateral mastectomy, or some women want to just have one, or some women want to have a lumpectomy. You want to discuss these decisions with your partner and make the decision together. So at the end of it all, you both came to that decision together, and it's easier, you know, to handle, easier to deal with. Yeah. So what I'm going to do the next time, I'm going to be showing you 3 beautiful ways, and that's going to be head wrap session 2. In our last video, we gave you 2 or 3 different ways you can tie your head. So my next video, I'm going to be talking about, 3 beautiful ways that you can tie your head to make yourself look pretty. Now, you don't necessarily have to tie your head. You can buy a wig. There are just absolutely gorgeous wigs out there. Buy a wig, right? You can wrap your head in turban style. You can wrap your head beautifully. You can wear a baseball cap or wear a beautiful hat. And there's so many ways you can make yourself look really pretty. Or just wear your bald head. Bald head actually looks very pretty. You put some beautiful earrings, necklace, and then make yourself look pretty. So next time we'll be talking about 3 beautiful ways you can tie your head. It's going to be head wrap tutorial session 2. So watch out for this video, and thank you so much for watching. Thank you for subscribing. I sincerely appreciate it, and see you next time. If this is your first time watching my channel, I would appreciate if you would subscribe. If you want to see the beautiful head wraps we're coming with, go ahead and subscribe. Leave a comment. Tell me what you think. If you love this, if you like this video, please let me know what you think. Tell me about whether you've had hair loss. Do you know someone who's had hair loss? How did they cope with it? Let's be a little interactive. And also go ahead and click that little bell icon so you can be notified when I release another video. Thank you so much for watching Dr. Paula's Health Network. Appreciate it. See you next time. Bye.